Hello. The hoverjack is an inflatable mattress system designed for lifting patients off the floor. This video will show you how to use the hoverjack in combination with the hover mat. You should consider using the hoverjack to lift any patient, but especially obese patients with limited mobility. The hoverjack system is very easy to use, minimises discomfort to the patient, can be used on patients weighing up to 85 stone or 540 kilograms, reduces the risk of back injuries in healthcare professionals, and requires a minimum of 2 carers or healthcare professionals. As the bottom of the hoverjack is Teflon coated, it moves easily on any type of flooring, including tarmac, carpet and lino, meaning that patients who fall outside can be lifted off the ground and easily transported to a treatment area. To lift a patient, you need the following equipment. Personal protective equipment in line with your trust policy. Use non-sterile gloves as a minimum. The blue hoverjack patient lifting system, a purple hover mat, the air supply. Before you begin, perform a risk assessment to exclude any injuries or fractures which may need treating before moving the patient. Have you and your colleague been trained to use the hoverjack? If not, please ask for assistance from a staff member trained in the use of the hoverjack, for example, a member of your manual handling team. Does the patient have a diagnosed or suspected spinal injury? If they do, it is still possible to use the device, but the patient must be positioned on a spinal board first. Is the patient's dignity at risk? If so, please erect a screen around the patient. Explain to the patient that you are going to use an inflatable device to lift them off the floor and that it is noisy. If the patient is in a confined space, such as a toilet, you may be able to use the hover mat on its own to transfer the patient to a more open area where the hoverjack can be used. If this is not possible, you will need to use a slide sheet to move the patient into a larger area such as a corridor before using the hoverjack. You may also have to move furniture in order to carry out the procedure. When you have sufficient room, lay the blue hoverjack and purple hover mat side by side next to the patient on the floor. Ensure that the blue hoverjack is the correct way up, with the black Teflon surface at the bottom. Ensure that the 4 red deflation valve screw caps are securely in place. The purple hover mat should be positioned so that the air inlet is at the foot end of the patient. Plug the air supply into a main socket and reset the orange trip button on the circuit breaker unit if you are going to use one. Log roll the patient onto the hover mat. Make sure that the patient is central and then loosely attach the purple safety straps over the patient. Attach the green extension straps onto the hover mat. Insert the nozzle of the air supply tube into one of the 2 air inlets at the foot of the hover mat. To secure the nozzle, use the button to clip the nozzle and air inlet together and attach the velcro strap over the top. Inflate the mat by switching on the air supply. Once the hover mat is inflated, leave the air supply running. Grasp the green extension straps and slide the patient onto the deflated hoverjack. You may find it easier to pull the patient at an angle with the head first. Once the patient and hover mat are positioned centrally over the hoverjack, turn off the air supply by pressing the standby button. Allow the hover mat to automatically deflate before detaching the nozzle. Secure the blue safety straps of the hoverjack loosely around the patient. Now inflate the hoverjack one section at a time, starting with the bottom air chamber. Hold the hose of the air supply against valve number 1 and turn on the air supply. The chamber will start to inflate. Once the chamber is fully inflated, remove the hose from the valve. The valve will automatically close to prevent the chamber deflating. Repeat the same processes with the next 3 air chambers, working from bottom to top. If you are transferring the patient to a low bed, you may only need to inflate 3 of the 4 chambers. Ensure that each chamber being used is fully inflated and feels firm before you proceed to fill the next chamber. Once the chambers are inflated, turn off the air supply by pressing the standby button. Slide the hoverjack and the patient to the side of the bed or move the bed to the hoverjack. You need to make sure that the bed is level with or slightly lower than the hoverjack. Once in position, you can detach the blue straps that are securing the patient. To slide the patient onto the bed, re-inflate the hover mat. Connect the nozzle to the air inlet as before and press the brown button to inflate. When the hover mat is fully inflated, slide the patient onto the bed. We recommend that 2 healthcare professionals pull the hover mat from the opposite side of the bed using the extension straps. It is important that a member of staff stands by the hover jack and braces it against the side of the bed to prevent it drifting away from the bed during the transfer. Once the patient is on the bed, turn off the air supply and allow the hover mat to deflate. Remove the nozzle and then log roll the patient to remove the mat. Once the patient is safely positioned on the bed, deflate the hover jack by removing the red caps in turn from the air chambers. Once the hover jack is fully deflated, replace the red caps so the unit is ready for use. Clean the hover jack and hover mat using a chlorhexidine or soap wipe in line with local infection control protocols. You must report any faults or damage to the equipment to the Medical Electronics Department. If you have any questions about using the HoverJack Air Patient List system, please contact the manual handling team.